All right, so get ready because we're diving into a global health challenge that's way more interesting than you might think at first.
Oh, yeah.
It all revolves around Africa's health security, funding cuts, and this big push for self-reliance.
Hmm.
We're going to be looking at excerpts from this podcast episode called Global Health Crossroads, Africa's Fight for Health Security.
Sounds pretty intense.
Yeah, it is. It's like if you can imagine a geopolitical thriller,
Okay.
but instead of spies, you've got scientists and outbreaks, and it's a real race against time.
Wow. Okay, I'm intrigued.
So Africa's at this crossroads, right? They're dealing with all these health crises, like infectious diseases on the rise.
Right.
Vaccine access is still a big problem, and healthcare systems, they're still recovering from COVID.
Yeah, it's a lot to deal with.
And then, on top of all that, there's a major funding shortfall, which could make all these problems even worse.
Absolutely.
Now, the Africa CDC, they play a vital role in coordinating disease surveillance and outbreak response.
All right.
They've been hit hard by these funding cuts, especially from the U.S. So under the Trump administration, funding to the Africa CDC got slashed, like from $500 million down to $385 million.
Wow.
What does a cut like that even mean on the ground, like in real terms?
Well, it could mean a lot of things, and none of them are good. We could be talking an additional 2 to 4 million deaths every year from preventable diseases.
Oh, wow.
And it's not just that. It also means potentially pushing 39 billion more people into poverty.
Wow.
Not to mention billions of dollars lost for the continent as a whole.
Those numbers are alarming. This is clearly a major problem for Africa, but why should the rest of the world care about this?
Well, you got to think about it. Disease outbreaks don't really respect borders, do they?
Right.
Weak health systems anywhere, they put everyone at risk. I mean, if Africa can't contain an outbreak, the whole world feels the consequences.
Yeah, that's a really good point. It really shows you how interconnected global health really is.
Yeah, for sure.
But it's not all doom and gloom, right? I mean, there are some positive developments. There's this new African Epidemic Fund.
Oh, absolutely. The African Epidemic Fund, that's a real game changer.
Yeah.
It's a great initiative. They're basically taking leftover COVID-19 relief funds and pooling them so they can respond quickly to new health threats.
What I find really interesting about this fund is that it gives the Africa CDC financial autonomy.
Right.
They don't have to wait around for international donors to step in when a crisis hits.
Exactly. That's huge. It makes them so much more agile and responsive, which is exactly what they need to be.
So we're seeing a move towards self-sufficiency, right? Like not being entirely dependent on external aid.
Definitely. And there's another really promising development, particularly with the Mpox vaccine.
Oh, yeah. Tell me about that.
Well, there's been this technology transfer agreement between a Danish biotech firm and an African company.
Okay.
And it's opening the door for Africa to produce the Mpox vaccine locally.
So instead of relying on international suppliers, which, let's be honest, can be pretty unreliable sometimes,
Yeah, for sure.
African nations could manufacture these vaccines themselves.
Precisely. It's all about reducing that reliance on foreign aid and building sustainable
Yeah.
healthcare systems.
Right.
And it's not just about Mpox. This could be a model for other vaccines, even other medical technologies in the future.
So the progress on the Mpox vaccine, that's a step in the right direction.
Yeah, definitely.
But all of this is happening against a backdrop of shifting global power dynamics, right? Especially with the U.S. kind of scaling back its global involvement.
You're exactly right.
Like you mentioned earlier, what exactly do you mean by that?
Well, there's this global trend away from multilateralism, and when the U.S. cuts back on funding, it creates a sort of leadership vacuum in the global health arena.
So other players are kind of stepping in to fill that void?
Precisely. We're seeing countries like China increasing their influence in Africa, providing funding and support where the U.S. has stepped back.
What are the implications of that shift, though?
Well, some U.S. policymakers are getting worried that China might end up calling the shots in global health cooperation. There's a concern about the U.S. losing influence and the whole global health landscape becoming less collaborative as a result.
So it sounds like we're at a pretty critical moment. You've got funding cuts, you've got these initiatives for self-reliance, and you've got these shifting global power dynamics. It's all very complex.
It is. It really is.
Where do we go from here? What can be done to ensure global health security remains a top priority?
That's the billion-dollar question, isn't it? Well, there are a few paths forward. First off, Africa really needs to double down on its push for self-reliance. Initiatives like the African Epidemic Fund and local vaccine production, those are crucial.
Yeah.
Those are key to building more resilient healthcare systems. But that's not the whole picture. We also need to think about the bigger picture of global health governance
Okay.
and how that needs to evolve.
Yeah, that makes sense. You were saying we need to consider this bigger picture of global health governance.
Right, right.
What exactly does that mean? Like, what are some of the issues with how things are set up now?
Well, look at what's happening in Africa.
Okay.
It really highlights the flaws in how global health is governed. The whole system relies way too much on individual nations making decisions.
Yeah.
And as we've seen with the U.S. funding cuts, that can create a ton of instability.
It's not a very reliable system, especially when powerful countries change their priorities.
Yeah, exactly.
So what would a better system look like? Something more stable, more equitable?
Well, there's this idea gaining traction, a global health treaty.
A treaty specifically for global health.
Yep. Basically, it would be this legally binding agreement between countries. It would outline everyone's shared responsibilities and commitments when it comes to global health security.
So what would that actually look like in practice?
I mean, it could include things like setting minimum funding levels for global health initiatives,
Okay.
maybe creating clear procedures for responding to outbreaks, and ensuring everyone has fair access to essential healthcare technologies.
That sounds good on paper, but getting every country in the world to agree on something like that,
Oh, yeah.
it seems pretty ambitious, doesn't it?
It would be a huge undertaking, definitely.
Yeah.
But the COVID-19 pandemic, it really showed us how badly we need stronger international cooperation on health.
Right.
A lot of countries are realizing that the current system just isn't cutting it.
So the pandemic, as terrible as it was,
Yeah.
it might actually be the push we need for positive change in how we approach global health.
I think so. I mean, it was this shared experience,
Yeah.
It really hammered home the idea that we're all in this together when it comes to health.
Right.
It could be the catalyst for real reform.
It's like a global wake-up call
Exactly.
to rethink our systems and come up with new solutions.
Yeah.
But you also mentioned empowering regional organizations like the Africa CDC.
Right.
Where does that fit into all of this?
Well, it can't just be about top-down solutions like a treaty.
Okay.
We also have to give regional organizations the power to take ownership of their health security.
I can see how that would make them more effective, giving them more autonomy, more resources.
Exactly. And, I mean, look at the African CDC.
Yeah.
They were super successful coordinating the COVID-19 response.
Right.
And they've been pushing for self-reliance in African healthcare. Strengthening these kinds of organizations is key.
So it's like a two-pronged approach.
Yeah.
Strengthening global governance, maybe through something like a treaty, and then empowering those regional organizations to take charge on the ground.
Exactly.
What else needs to happen to make all of this a reality?
I think besides structural changes, we need a narrative shift.
Okay.
For too long, global health has been seen as this humanitarian issue,
Yeah.
like something rich countries do out of the goodness of their hearts.
Right.
We need to start seeing it as an investment, a critical part of national security, a fundamental element of sustainable development.
So it's not just about altruism. It's
Right.
about recognizing that investing in global health is in everyone's best interests.
Precisely. It's about understanding that neglecting health in one part of the world, it creates risks for everyone.
It's like that saying, no one is safe until everyone is safe.
Exactly.
That's a powerful reminder of how interconnected we all are.
It is.
But getting people to think that way, to look beyond their own borders, that's a big challenge.
It is. It is. But I'm optimistic.
Okay.
There's growing awareness, especially among younger generations. They seem much more in tune with this idea of global interconnectedness.
Right.
And again, the pandemic, for all its devastation, it really drove home how connected we all are.
So there's hope, but it'll take a collective effort, governments, international organizations, individuals, everyone. Speaking of individuals, what can ordinary people actually do to contribute to this?
Yeah,
It's easy to feel overwhelmed by these huge issues,
I know.
Like, what can I do that will actually make a difference?
I understand that feeling.
Yeah.
But I really believe that everyone has a role to play in building a healthy and more equitable world.
Okay.
It starts with awareness, educating ourselves about these issues, understanding how interconnected we all are.
So knowledge is power.
It really is. It's a powerful starting point. And once we have that awareness, then we can start taking action.
What kind of action? What are some examples?
It could be as simple as supporting organizations that are working to improve global health.
Okay.
There are so many NGOs, charities, research institutions doing amazing work.
Yeah.
Donating your time or money can make a real difference.
And what about advocating for change?
Absolutely. Contact your elected officials, sign petitions, participate in online campaigns.
Right.
All of that helps raise awareness and push for better policies.
So we can use our voices, use our votes to hold our leaders accountable.
Exactly.
What about in our daily lives? What choices can we make that make a difference?
Well, you can buy fair trade products that support sustainable development. Reduce your carbon footprint, be mindful of your consumption habits. All of those things contribute.
It's about recognizing that our individual choices can have a ripple effect.
That's the takeaway. We're all part of a global ecosystem.
Yeah.
And our choices, they have an impact on people all over the world.
We've talked about funding challenges in Africa, reforming global governance, individual action. It's been a really insightful conversation.
They have been.
But there's one more thing we need to talk about. the ethical dimension of global health.
Right.
What are the moral obligations of wealthy nations when it comes to supporting health in lower-income countries?
Yeah.
How do we navigate issues of justice, equity, and human rights?
Those are crucial questions. Absolutely
Yeah.
crucial. It's time to delve into the ethical heart of this whole conversation.
We've talked a lot about systems and structures, but at the end of the day, global health, it's about people.
Yeah.
It's about everyone having a fair shot at a healthy life, no matter where they're born or what kind of resources they have access to.
Absolutely.
And that brings us to, I think, the most important part of this whole conversation, the ethics of it all.
Couldn't agree more. The ethical side of global health, it's so important, but it's often overlooked.
Yeah, for sure.
We're talking about fundamental issues here. Justice, fairness, basic human rights.
Let's break it down a bit.
Okay.
What are some of the biggest ethical challenges we need to be thinking about in global health?
Well, one of the biggest is this massive gap in health outcomes between high-income and low-income countries.
Right.
It's a stark reality. A child born in a wealthy nation, they can expect to live decades longer than a child born into poverty.
Yeah.
And it's not just a statistic, it's a reflection of these deep-rooted inequalities.
It really highlights how your birthplace can have such a huge impact on your health.
Exactly, sometimes even more than genetics.
Right.
And these disparities, they come from all these interconnected factors: poverty, lack of healthcare access, environmental damage, even systemic discrimination.
So where do we even begin to tackle something this complex?
I know it can feel overwhelming,
Yeah.
but we can't let that paralyze us. We have to start somewhere. And I think a good starting point is recognizing that health is a fundamental human right.
Okay.
It's not a privilege for the wealthy or those who happen to be born in the right place.
So shifting our thinking of charity to a rights-based approach.
Exactly. When we start seeing health as a human right, it changes everything. It forces us to confront the systems that are preventing people from getting the care they need.
And it puts the responsibility on wealthier nations
Yeah.
to step up and support the health of those who are less fortunate.
Absolutely. We can't just turn a blind eye to suffering, especially when we have the resources to make a difference.
But there's always that argument that countries should prioritize their own citizens first,
Right.
that spending on global health takes away from domestic needs.
That's a common argument, but honestly, I think it's a false dichotomy.
Okay.
Investing in global health, it's not a zero-sum game. In fact, creating a healthier, more stable world,
Yeah.
it benefits everyone.
Because as we've talked about, diseases don't care about borders.
Exactly.
A health crisis anywhere can quickly become a global threat.
Right. And beyond the practical reasons, there's also a moral imperative to act. We're all part of the human family. National borders, they don't change that. When we see people suffering, we have a responsibility to help. It's about compassion. It's about action.
So it's about recognizing our shared humanity, that we're all interconnected.
Yeah.
But even if we all agree on that, how do we actually put it into practice? How do we make a difference effectively and sustainably?
That's the real question, isn't it? It's not just about throwing money at the problem. It's about approaching global health with humility and a spirit of partnership.
What do you mean by that?
Well, for a long time, global health has been dominated by wealthy nations,
Yeah.
dictating solutions, imposing their priorities on lower-income countries.
Right.
And that approach, frankly, it's been criticized for being ineffective and kind of condescending.
So you're saying we need to move away from this donor-recipient model towards a more collaborative and equal partnership.
Exactly. We need to listen to the people who are actually experiencing these health disparities
Yeah.
and work together to find solutions that meet their specific needs.
So empowering communities to take control of their own health.
Yes. Give them the resources they need, the knowledge they need to thrive.
And that requires a long-term commitment.
Right. Absolutely. We can't just offer temporary Band-Aids. We have to invest in strong healthcare systems,
Yeah.
train healthcare workers,
Right.
address those social and economic factors that influence health. It's a holistic approach, recognizing that health is connected to every aspect of a person's life.
We've come a long way in this conversation. We started by looking at the funding challenges in Africa, then explored how global health is governed and how that needs to change. And now we've arrived at the ethical core of it all.
It's been a fantastic discussion. The future of global health depends on our willingness to have these tough conversations, to challenge our assumptions, and to work together to build a more just and equitable world.
And for our listeners, I hope this deep dive has given you some new things to think about. Global health, it's not some abstract concept. It's about real people's lives.
It is.
And it's a challenge that demands our attention, our compassion, and our action.
We can't afford to ignore global health. It's not, can we afford to invest? It's, can we afford not to?
Couldn't have said it better myself. We'll leave you with this. Imagine a world where every region had the resources and the freedom to tackle their health challenges head on. What would that look like? And what role can we each play in making that a reality? Until next time, stay curious, Stay engaged and keep diving deep.